Mike, one of the common questions that we get with people that do experience some knee discomfort and they are athletic is if they are experiencing knee pain currently and they want to go out and be athletic and it's colder outside, are they at risk of damaging their knee even more than what they're currently experiencing?
Not necessarily, because I think it comes down to if that person hasn't run in a while, there's still some base foundations, things that they need before they get back into being a runner. Having the strength, having the flexibility, having the biomechanics. So I think it's important if they have a history of being a runner and they go through this program to gain the strength, gain the flexibility, gain the mobility that they need and progress back into it. Because I think a key thing, whether it be rehab or conditioning or training, the key word is progression. Starting slow and building up, and not have a flashback of when I was a great athlete 10 years ago and suddenly go back and try to run that mile time or hit that 30-foot jump shot. I think it's important to progress back into it. And when it gets to cold weather, a big part of that really is kind of warming things up. And this is a great program to limber things, to increase the length of muscles to get back to it. Because the thing we want to project here with the people reading this and watching this at home is the fact that they want to prevent injuries. There's an old saying in physical therapy, if you're not going to make the patient better, at least don't make them worse. So jumping into things too aggressively really can cause a problem. So I think this is a great program to get people back to what they want to do, but there will be a progression from where they are to where they want to be.
That's great information, Mike. Definitely, I have a very similar saying. It's much easier to keep somebody out of trouble than it is to get them out of trouble. And one of the unique processes behind the FPR series is that L3 process of limber, load, and lengthen. Now, for some of the individuals that I see that are runners, that are experiencing things like discomfort with running, I actually get them to go through and do the limbering portion before they actually do their run. Then they can do the loading portion after they've done some of the running and their cardio, and then they go through the lengthening portion. When they implement that type of progressive approach, like you've mentioned, they start seeing results at a faster rate, and the discomfort that they once experienced goes away.